Well, welcome everyone. I'm so excited to have y'all here today. We're going to be filming, what is the face of a sexual assault nurse examiner in Missouri, and really personalizing and inspiring how somebody could seek out to become a SANE in Missouri. So I'm really thrilled that we have good representation from the state today. Why don't we start by each of you introducing your name and what facility you work for and what part of the state you're in.
My name is Jennifer Greene, and I work in Kansas City out of St. Luke's Health System, so I'm the Clinical Forensic Care Program Manager for our system. We have a total of 14 hospitals and a full forensic program. I've been at this for a little over 10 years.
Thank you.
My name is Dawn Day. I work at Mercy Hospital in Springfield, Missouri. In conjunction with other hospitals in town, we run the SART program there in town, and the program has been in Springfield, going strong for almost 10 years, and I've been the program coordinator for the past 6 years.
And I'm Natalie Moen. I'm the forensic program coordinator for Mosaic Life Care in St. Joseph, Missouri. And I've been there since 2012. So we've always seen sexual assault patients, but we've never had a designated program until then. Great.
And I'm Cathy Howard. I'm from St. Louis University Hospital in St. Louis. I'm the forensic nursing coordinator there, and we also have a full forensic program for victims of abuse.
So let's start this time with Cathy and work our way backwards. So Cathy, how long have you been a nurse, and then how long have you been a SANE? Like what caused you to make that transition? But how long have you been a nurse, and how long have you been a SANE?
47 years I've been a nurse.
Oh, wow.
A long time. Yeah, a while. I've been in forensics since I started working in the emergency room in 1989. I was director of an emergency room that did a lot of we had the highest number of sexual assaults in the city, and I really got interested into it at that point. I love the forensics part of it, the criminology, the collection of evidence side. That's always really fascinated me, to be able to put that skill to use.
I have been a nurse for 10 years and a SANE forensic nurse for 6. And I've always worked ER, and so when I moved to St. Joseph, part of their orientation process was you had to take a SANE course. So I did that. And then I think everything, just learning from how you can improve. We looked at it and they had every nurse go through that, and we just saw that things were not working that way at all, and we weren't providing kind of the best care and experts, so just kind of started looking at what other people do and looking at, I'm sure we'll get into this, but finding mentors, so Jen being one of them, and Connie Brogan from St. Luke's, and just like, hey, how did you guys start? Where are you at now? And then we just kind of worked from there.
I have been a nurse for 12 years, a SANE nurse for 10. I was always interested in caring for victims of sexual assault. We never had a program in the emergency room I was in. Any nurse in the ER would care for a victim of sexual assault if they came in. It wasn't until I had a physician that was new to the hospital that said, I need you to activate the SART team. And we were all like, what is that? And he became our medical director, and he started the SANE program where we were at. So the nurses that wanted to do it got trained. I love the position I'm in. I got into nursing to care for patients, and I think that this is the biggest thing that a nurse can do to care for patients, because in our facility, the nurses work individually of the physicians. As a SANE nurse, you were there caring for the patient one-on-one. You're the victim advocate, you're the forensic evidence coordinator, you need to have compassion and care, and I think that that's the one time that I feel like I can honestly, for a long period of time, touch the life of a patient in the emergency room setting. So I love from that aspect.
And let's see, I've been a nurse for 12 years, a forensic nurse for 11. Most of my background has been a forensic nurse in conjunction with another area, so it's been ICU, ER, critical care, adrenaline, essentially. And I started in this field because I was in the emergency department, and a SANE came in, and I didn't know what to do, and the hospital I was working for didn't have a program. I knew in that period of time taking care of that young lady that I was doing her a huge disservice and possibly causing additional trauma by not knowing, getting out the directions and reading the directions in front of the patient. And I made a promise to myself in that moment that that would never happen again, and that anyone coming after her would get the standard of care that they deserve in that moment. My job is to help facilitate healing physically, mentally, emotionally, and spiritually, and that's where I spend my energy. Oh, and I collect some evidence too.
So wealth of expertise in this room. I want to make sure that people do understand there are different types of SANEs. There's the pediatric, there's the adult. Could y'all briefly talk about the difference in what you are trained in?
I'm adult, adolescent. We take care of patients that are 14 years and above. We don't do pediatrics in our facility, so we only care for that. I also do the training in the St. Louis metropolitan area, and as such only do training for adult adolescents.
I think that there's something, the word SANE trained and SANE certified get used interchangeably a lot, and there is a difference. You can go to a training and be SANE trained and be able to function as a SANE nurse, sexual assault nurse examiner, and care for that adolescent adult population, which is 14 and up. To be certified, you have to go through a certification test, which is what the SANE A or SANE P is, SANE adult or SANE pediatrics. In the state of Missouri, nurse practitioners can care for the SANE pediatric population. And we do not do those at our facility either. We have a child advocacy center in the community that we are in, where pediatric victims of assault go there and are cared for by nurse practitioners that are certified in that care. But the nurses that we have in our emergency room, you can care for victims of sexual assault without having their certification behind your name, but it is a wonderful asset to have, to be able to go on to that continuing education and take that certification test to consider yourself a SANE A.
Okay. Well, we'll talk more about kind of the certification and training opportunities in a little bit, but thank you for the explanation, because sometimes people don't realize there is a difference, and that we're really talking in this video about the sexual assault nurse examiners who have gone through training for the adult adolescent, the 14 and older, and just wanted to make that clear. So what do you see as the role of the SANE, your role in the coordinated community response to address sexual assault? Like, what is unique and specific about your role that no one else is going to be able to do, right? Like, this is your niche.
I think from having done the training now for over 15 years, I get emergency room nurses coming into the training who've had no forensic experience at all. We pre-test them, as I'm sure you guys all do, and their knowledge base is very limited. But yet in many ERs, those are the same nurses that are collecting the evidence. So I think by going through the 40-hour training, we're teaching them the proper evidence collection, as well as understanding the trauma that the victim goes through during an assault, and we're better able to provide really a full comprehensive examination and evidence collection of the victim in the ER.
I think it's a really growing specialty too. I think it used to be more that you were just an evidence collector, and yes, that's, you know, an important component of it, but it's so much more than that. And so getting to do all that, you know, additional education on trauma-informed care, and just how much every step of the way and every interaction can make such a difference for that patient. And so I think especially if you come from ER background, which we love ER, most of us do, that's where, you know, our home is, but you don't have a lot of time with the patients. You are very, very fast paced. And so depending on how your program is set up or how you guys are, ideally to have that same nurse come in that can be truly one-on-one with that patient and have that undivided care and patience, and not have to be rushed, and give that, you know, that patient that's just come in all the time and attention that they need, and knowing that it's so much more than just the kit and that evidence you're collecting, but just the, like Jen mentioned earlier, like the whole patient, and really being able to give them that best care, I think is what makes being a SANE nurse so awesome, a forensic nurse so awesome. And then it's growing. There's such an expertise to it, and there's a lot more than just evidence and what's in the kit, and just how you can grow and expand on that, and that expertise, I think, is a real honor and really something unique about the position.
Well, as Natalie mentioned, it's a growing field. I think probably when it first started in Kansas City, the class was maybe 8 hours, and the book was that big. And then as we got further along and the International Association puts out the standards and the objectives that should be met with these 40-hour trainings, then the book becomes this big and 40 hours worth, which covers everything from the history and the ethics of the practice, crime lab, prosecution, domestic violence, elder abuse, child abuse, forensic photography, because that's not a nursing skill, the evidence collection piece, human trafficking. There's just so many different components to that training that produces a very well-rounded new forensic nurse. And as you guys well know as I do, that is the basis of what they need to know, and they're going to learn a whole lot more once they're in the field with the mentorship. So I look at our role that way, is that not only are we looking at our objectives and constantly improving those based on current practice and advancements, but then we're also providing that mentorship to the other folks in our community to make sure that that they get to take on some of the expertise that we've worked so hard to build.
I think it's like everyone spoke, it's an awesome growing field. When we first entered, you were a sexual assault nurse examiner. You cared for victims of sexual assault. That terminology is being transitioned over into a forensic nurse because you look at all aspects of forensic care. I care for victims of domestic violence, of any type of pediatric or elderly abuse, and now we're getting in the human trafficking world. So the niche that I got myself into has expanded into all types of forensics, which also involves traumatic forensics as well in the emergency room setting, where I'm called over to help with gunshot wounds or knives or anything like that, to help with the forensic collection of that. So it's not just sexual assault, it's any type of forensic evidence at all in regards to abuse or neglect of a patient.
So you're obviously all very passionate about this, and y'all have kind of touched on it, but what would you identify as most rewarding about somebody when somebody chooses to become a SANE? What is the most rewarding thing when you look at it, and the reason you take so much time and have continued to be dedicated to creating a SANE program in your area? What's the most rewarding thing about it?
The transformation.
Mm-hmm.
We walk into the room, if we're invited into the room for the patient, and they might be under blankets in a fetal position and crying, and by the time we've worked through an entire process with that person, they're laughing, they're smiling,
Exactly.
Their posture changes, they recognize that they do have power and control back, and they get to make all the decisions about their care, and be informed about all the different decisions that they can make, and they walk out of our care having gone through this, and I get to watch that, I get to be a part of it. I get to see a person in their strongest moment and be a part of that, whatever that looks like for them, that moment of empowerment. And that's why I keep doing what I'm doing, because I get to be a part of that.
I think it's so important because a lot of times victims will come into the emergency room only being able to say, I was raped, I don't know what to do. Mm-hmm. And to be able to guide them to make the decision that's best for them, whether it be what we think they should do or not. It's just really empowering for me to know that whatever we've done for them, it's what they were informed, and they made a choice to do that. And then those few cases when you actually go to trial, mm-hmm. which we just had a big one last week, is the ultimate satisfaction to know that you've helped to hold a perpetrator accountable for his actions.
Anything for Natalie or Dawn that hasn't been mentioned? Is there something that comes to mind about what you identify as most rewarding?
I think that both of those are wonderful explanations of what I find very rewarding. And then there are often sometimes where you do have, where you can see long-term change in a victim. Sometimes they will reach back out to you and let you know where they are at in their life, what changes they've made in their lifespan. And a lot of times they will say, because of the experience that I had or what I went through or what you helped me with, and that is a huge motivator to continue doing, because the period of time we have to affect these individuals' lives is very small in the span of what they're going to be doing the rest of their life. And to know that the interaction that we have in their most traumatic moment in their life, they take the interaction that they have with us, and it helps form them into the future person that they are going to be, and the strong-willed person and the survivor that they're going to grow into. So that impact means a lot, to know that we can help them in that traumatic time to go forward and be the strong people that they are going into.
I do want to just say one thing. In the nearly 20 years that I've been doing this, I can never remember a case where we've actually gone to trial, which is usually the next time I'll see a victim. We usually don't see them unless they come back to the ER, where I've never had a victim not come up to me and say, I remember you. I'm going to cry. You came in at 3 in the morning to take care of me. That's why we do it.
Yeah.
So they never forget how you make them feel. And so I just think, regardless, take out the trial. I mean, obviously we'd all love if they had, you know, justice that they want and they went to court, but just knowing that no matter what everyone else in society and everything else makes you feel, that you're going to feel very safe and that we trust, you know, that they trust us and that we believe them. And so I think, you know, that's what I always try to encourage my nurses. It's like they will feel safe when they're here, like truly safe, that we care and we want to be here and that we don't have, you know, somewhere else we want to be. And I just think to know that's like such an empowering thing to know, that I don't want to be one other person that, you know, makes them feel judged or doubted, but just that person that was there for them and heard them and, you said, gave them whatever they needed. You know, it looks different for different people, and so
I know, talking
really
to a
awesome.
lot of victims, they'll talk about the event itself was traumatic, yet it's what happened when they reached out for help that either led to healing or led to re-victimization or made it even more traumatic. And so y'all play a very key role in starting that healing of when somebody has come forward, whether they want to report to law enforcement or not, they at least want somebody to validate what they've gone through and talk them through it. So y'all play an absolutely key role in starting to facilitate that healing so that somebody is able to decide what options and decisions they want to move forward in that process.